In antimicrobial resistance, there are lots and lots of ethical and moral challenges. One of the most important, in my opinion, is the fact that it has unequal burdens. Populations and communities who are the poorest and most disadvantaged, they bear the worst burden. For example, people who live in low-resource settings, people who have lack of access to healthcare, people who work in unsanitary conditions, they are prone to infectious diseases and drug-resistant infections. And they're also the very people who might be the worst off when it comes to AMR mitigation plans. AMR mitigation plans, while well-intentioned, could inadvertently exacerbate existing inequalities. For example, if measures are put to limit over-the-counter use of antibiotics, people who have lack of access to antibiotics may not get any antibiotics and therefore they will be worse off. Another example is farmers who might need antibiotics for their livestock, especially smallholders. It may affect their livelihoods. So, and the other thing is that there's inherent ethical tensions and competing interests in AMR mitigation plans. So, for example, if you're ill, your primary interest is to get better, and whatever it takes, whether you're rich or poor. AMR is secondary at best, if you know about AMR at all. A physician or a healthcare professional treating someone who's ill in front of them, their primary interest is the patient in front of them. AMR is at best secondary. A pharmacist or a shop owner selling antibiotics, their primary interest is their livelihood. It's not about AMR. And the other big thing is intergenerational justice. There's a competing interest with the generation now and future generations. Are we now exhausting our resources for the sake of our well-being at the expense of future generations? AMR, antimicrobial resistance, is so difficult to explain. It's abstract in nature, people cannot see it. So to explain AMR itself to even healthcare professionals is difficult. So we work a lot with communities in Southeast Asia where there's no direct translation of antimicrobial resistance, so it's really even more difficult to communicate. In some countries, there's no word for AMR and no word for antibiotics. In Thailand, for example, many people refer to antibiotics as anti-inflammatory. So this perpetuates the inappropriate use because people use it as anti-inflammatories. So when we do engagement programs, we have to be very careful and have to think about these projects carefully. That's why we use arts, the circus, drama, and things like that. So the first and the most important thing is to know your audience. So we consult with our audience and their stakeholders locally about what's the best medium. For example, in Thailand, if we are targeting youth, cartoons are the best way. They told us that they love manga, the Japanese cartoon. In Cambodia, where we work with youth as well, they like going to the circus. So we partnered with a circus company to create a performance about AMR. And with AMR, because it's so complicated, we need to get the wording right, we need to get the messages right, we need to get the call for action right. Call for action that they can actually respond to, that would also minimize unintended consequences. We really don't want to instill fear in people, or fear of antibiotics, fear of modern medicines, or people might even stigmatize farmers if we get the messages wrong. What we have, as a team, have learned is that the more the local partners create or co-create the project, the better. So in our team, in our projects, the circus company is local. And we have actually minimal input in the creative process. Scientists will make sure that the messages are scientifically accurate, and the creative partners will take the creative process.